Welcome to one dot present here. So today is the last. Sorry for the interruption. Today is the 12th, 13th day. That is the last day validatory sessions. We had a 1 month webinar, national webinar on training program on newborn care for nurses in collaboration with ECO India. So today is the last day validatory session. I welcome Dr. Janki Patel, Madam, from Ganpati University, KB Institute of Nursing, Gujarat, for today's validatory sessions to deliver a speech on evidence-based practice of newborn care. So all these 12 sessions we had on newborn care and newborn management. So today we end up with evidence-based practices, which is including in newborn care. So regarding Madam, she have completed her BSc from Gujarat University, MSc in Child Health Nursing from Bharati Vidyapeeth. PhD she has completed from Geetanjali Institute. Udaipur. She have a 12 year of experience, including clinical, teaching, research, and administration. Madam is a trainer for TB program, TOT trainer, and HIV/AIDS program. She is a member for Research Advisory Committee for PhD Scholar, and she served as an Admission Nodal Officer of Nursing and Allied Medical Admission Committee, Gujarat. Madam is a research guide for UG and PG students, question paper setter, paper evaluator in various universities across Gujarat. She's an editorial member in MAD journals, and she have received certificates of excellence in peer reviewing at BP International journals. Her achievement including she's a resource person for various national and international conferences, received best paper presentation award at international conference, presented so many papers at national and international conferences, 12 plus research publications for her credit in national and international journals, participated as a delegate, even as a resource person for various international and national conferences. She have a patent on her credit that is device for continuous metabolic monitoring. So I welcome you, ma'am, and thank you so much. Immense gratitude because on short notice, 2 days back, I have approached you. So within 2 days, you have agreed and you have prepared to be a resource person. I welcome you on behalf of Bharati Vidyapeeth College of Nursing, Navi Mumbai, for today's session. Over to you, ma'am.
Thank you so much, ma'am, Arunima ma'am, for inviting me as the expert for valedictory session. And same for you, it is applicable. When we called you, you have accepted our invitation within a short notice, and you have taken a very beautiful session on evidence-based. Thank you so much, ma'am. So, ma'am, can you share my PPT?
I can share, ma'am. Okay.
Or, ma'am, here I'm not getting any option to share.
Is it visible, madam?
Yes, ma'am.
You can start, ma'am.
So good afternoon, everyone. You are with the newborn care since 1 month, and it is a finally time for valedictory session, and it is time to learn what is the evidence-based newborn care. It will optimize the outcome of the newborn in a later life. So, first of all, what is the evidence-based nursing practice specially used for newborn care? So, when we are going for evidence-based, we are dealing with the available evidence, research, expertise, and with clinical experience, we can use the for the practice. So it will for the better outcome for the health of newborn. Ma'am, can you change my PPT? So first of all, in a evidence-based nursing practice for the newborn, it will include the thermoregulation, it will include infection control, breastfeeding, nutrition, pain management, neonatal resuscitation, and many aspects are there. So we know it is the golden hour. Same, we are using golden minute for neonatal resuscitation. So immediate newborn care for the golden hour. WHO recommended immediate skin to skin contact to reduce the newborn mortality up to 40%. It practice include delayed cord clamping. We know we have to keep baby on the mother's abdomen, mother's chest for a few minutes to increase the blood flow for the baby. It will increase the blood volume. It will increase the iron in a baby. So we can delay up to 1 to 3 minutes, and early breastfeeding within a first hour. It is essential. We can prevent many of the disease if we'll provide within a 1 hour of the birth of baby. And always we have to focus for the room air instead of we can use the room air 21% of oxygen. It's beneficial for the baby as the baby saturation during the fetal life, it is a 60 to 70 percentage. So at a time without need, if we are providing 100 percentage of O2, it will be a cause for baby's lungs, and delicate lung cannot bear 100 percentage of oxygen. So we have to try to use the room air and 21 percentage oxygen. It is a transitional period for the baby to adjust in the extrauterine life. And by the skin to skin contact, we can improve the thermoregulation. Mothers and babies bond also can increase, and it will initiate the breastfeeding success. So we have to keep in mind this golden hour, golden minute, it is most essential for the newborn care. Next is the thermal management preventing the hypothermia. So hypothermia, it is a very more prone to get for the newborn. So we know the conduction, convection, radiation, evaporation. These are the steps by that the baby will get the heat loss. So we have to keep we have to maintain the warm chain. So newborns are very susceptible for the hypothermia, increase the mortality, morbidity by 28%. So skin to skin contact will enhance the thermoregulation. We can provide the heat to the baby, and we have to dry immediately because amniotic fluid will be there on the baby's body. So we have to evaporate it, and we have to delay the bathing, specially because burning schedules are over the body. It will provide the natural thermoregulation to the baby. So we have to delay the bathing so we can prevent from the thermoregulation. And if it is needed, we can provide the radiant warmer or warm blanket also. But skin to skin contact, it is there are lots of evidences are there by the thermoregulation with the KMC, it will increase the weight gain also, bonding also. We can see especially for the premature and the IVGRB. Then breastfeeding, optimal nutrition. Exclusive breastfeeding we are using for the 6 month, only and only breastfeeding. It will reduce the infection risk up to 60%. It will support for mothers with lactation consultant and education, encourage on demand. We are using the BFHI policy to promote the breastfeeding and to enhance the breastfeeding. We know the colostrum is most essential for the baby. It will provide the immunoglobulin. It will reach in the sugar. It will all over. It is more watery later on for milk, hind milk, and it will reduce the allergic risk. So for baby, what is required? It is everything is available in the breastfeeding only. If it is a premature baby, mother have a premature milk. That is also essential for the babies for optimal growth and development. So that we have to adhere for the exclusive breastfeeding. Newborn screening and the early detection. So when baby is born in the labor room, we are doing the screening of the baby, newborn assessment, first of all. So we can come to know we are monitoring the ABGAR score. So if baby have a distress, there are a birth asphyxia, we can give the resuscitation, everything. We are giving the vitamin K especially to prevent any of the internal bleeding. So these also we can screen. After if ABGAR score, everything is up normal. If it is 6 to 8 or it is 10, we can shift the baby, and after that again we are screening for any congenital abnormality, and we can screen for the phenylketonuria, hypothyroidism, if it is a cystic fibrosis, and baby have a sickle cell disease if there is a history. So timely follow-up is essential for the screening. Safe sleep practice will reduce the risk of sleep according to the American Academy of Pediatric. It is a sudden infant death syndrome we can prevent by the safe sleep practice. So baby required the 20 to 22 hours of sleep if it is a newborn. So we have to providing the proper sleep without any noise. We can for this we can utilize the bedding concept. Okay, one of the current trends, bedding. We have to keep mother and baby in a one place, one bed for 24 hours. So mother can give the breastfeeding, mother can provide the KMC also, thermoregulation also maintaining, nutrition also maintaining. So we have to place the baby on the bassinet crib without any noise, and room sharing recommended without the bed sharing. Okay, so that also we can go. So bedding concept we can use as evidence to promote the health of newborn. Then prevention of the infection. So hand hygiene is a crucial for the newborn. Before touching to the each baby, we have to do the hand washing. So neonatal sepsis account for 15% of neonatal deaths. Strict hand washing provides the caregiver as essential. Delay bathing for at least 24 hours. So prophylaxis, in that we are giving the all the immunization. We have started with the vaccination newborn when it is at birth. We are giving the vitamin K injection. Then we are giving BCG, hepatitis B, and the OPV vaccine. So we can prevent any hemorrhagic disease if we have given the vitamin A. As I mentioned, delayed bathing, it is needed to prevent from the hypothermia, and we can protect the vernix caseosa, and it will be providing thermoregulation to the baby. Then hand so how we can maintain all over the evidence, how we know evidence, but when we are not doing the practice, it will not come up. So continuous education are vital. We must implement the standard protocol in hospital, and parental involvement also are key role for and ongoing research is needed to see the more evidence, and every newborn is deserve the start in life guided by evidence and the compassion. So this is regarding the evidence-based newborn care. So these all are the parameters we have to keep in mind when we are dealing with the newborn. Based available study, based available review, we can go for and we can practice in our daily life. It is all about the evidence-based newborn care. Then if for the pain management, we can use a non-pharmacological management during the breastfeeding. We can do the heel prick also. It will provide the baby cannot cry. It will provide such type of, and we can provide the sucrose even. So we can prevent the crying or pain. We can minimize the pain. This is from my side. Anybody have any question can ask.
Participants, if you wish to have your share your personal experience on evidence-based practice, those who are working in any clinical areas.
Especially, ma'am, what we are doing when we will use the planning, intervention, comparison, and outcome. One PICO is there, and for if we are taking any of the topic, we are going and identify the many of the reviews. It will support our study, and we can do the practice on that. And especially nowadays, when nesting is there, we can providing the nest like a structure for the newborn, so we can keep the baby in the that nest and baby feel like a warm, so that also we can utilize it.
Correlations.
Yes. And
We had actually
nowadays,
done a study regarding thermoregulation, ma'am, 5 years back in our.
okay, fine, ma'am. That's great, ma'am.
Any participants, if you wish to share any of your experience regarding evidence-based practice or 12 days of this extensive deliberate session, so you are welcome. Or any discussions, any doubt.
Hello.
Hello.
Good afternoon, ma'am.
Good afternoon.
Myself, Aparna Pai, speaking from Bharati Vidyapeeth College of Nursing, Sample. Ma'am, I would like to share that we too really have had done many researches into our hospital. Our PG students also, they have done like a non-pharmacological measures, as you said, like swaddling we have done during the heel lancing, and we are practicing that. Then after that, we have done the facility tucking also we have done, and after that, then while the stimulation, soul stimulation also we have done, so that the baby really they reduce the pain during the heel lancing. Then breast milk giving during the before the vaccination and even during the vaccination for the distraction, and using of like what we did non-facilitated taking. So many researches we have done, madam, and I'm really grateful. Even nesting what you said. So really, we are very really happy that our hospital also so much cooperating with us, and we are practicing that in our NICU. So really, these evidence-based practices are
That's
really
great.
very much useful
Yes.
for
If we'll do
practicing.
actually, then we will get the benefit.
Yes, yes.
Yes, it depends on our nurses whether we have to go for ideal one or shortcut. Yes,
Yeah.
but now we have a good knowledge.
Yeah. Now we are doing that which position is better, whether the prawn
Yes.
position, whether
Okay,
the right
Fabi.
lateral or left lateral. So we are
Great,
And
ma'am.
prawn position for
Great, huh?
respiratory is or
Yes.
for respiratory support.
Yes, means yeah. We are means routinely what we do now. Basically, we will without taking like we have not gone to the respiratory like a distressed babies, for the normal baby only. Which position is the best? That basically first we will check out, and then we will go to the again with some specific like distress or babies like that. So we have spoken with the neonatologist, and they are also guiding us so much. So very good topic it was, and very much
Great,
happy.
ma'am. Thank you, ma'am.
Thank you so much.
Thank you, Dr. Aparna Kale, ma'am, for sharing the experience and extensive. Like, we happy to know that you are doing extensive researches. Will motivate us also to do the same.
Yes, thank you so much.
Now it's my time to say release the report of this 12 days, like 1 month training program of newborn care nurses. I am immensely grateful to all the participants who just cooperated well, all the case presentators who have done the presentations on behalf of Bharati Vidyapeeth, College of Nursing, Navi Mumbai, Department of Pediatrics. I'm initially thanking everyone to make this program successful. So here we go for the report. Newborn care, why we have selected this topic? It's a high quality universal care. Actually, newborn care is right for it's a right for every newborn. Babies have to breathe normally, they have to be warm, and they have to be fed. That is a basic requirement. Also, they have a right to be protected from injury and infections. All newborns should have the access to the essential newborn care, and critical care should be provided for all the babies who are in need. Essential newborn care involves the immediate care at birth and essential care during the entire newborn period, and it is needed both in health facilities and at home. And for nurses, for caring newborn, it's a key priority to ensure warmth, providing immediate and thorough drying, promoting skin-to-skin contact, support breastfeeding, and monitoring their vital signs, and also assessing and addressing any potential complications. So this was the background for us to choose the program. And the goal which we have set before starting the program is to provide every newborn everywhere has the right to high quality universal health care. We hope the objective has imparted. The objective we had set was impart knowledge regarding assessment of newborn, understand the care and management of common neonatal health concerns, and to enhance nurses on practicing evidence-based quality care for the newborn. So with the result, I have few more slides to explain. So with the result, I feel the objective has met. We have our focus area was newborn care, and the outline of the program is it was a training program, included 13 sessions, so 12 deliberate sessions of teaching and one validatory session, that is of today. The course was done under virtual interactive teaching learning method, and had a case presentation and expert talks, discussions, question and answers, and the program was evaluated by a comprehensive pre and post test examination. So as I have mentioned previously, so there was 12 sessions. It was a 1 month program, which we have started in the month of February 24th. And today we are in the last day, for the last day. So this, we have started with antenatal care, then care of baby during the immediate newborn period, the assessment of newborn, the immediate and delayed care of newborn, thermoregulation, feeding practices, alternative feeding practices, kangaroo mother care, the role of nurse in NICU, communication skills and infection practices of newborn, and basic resuscitation of newborn. And finally, we have ended the topic with care of preterm and small for gestation babies. So this was the program schedule which we have completed. Then the anatomy, the structure of the program is, so every day we had an introductory and welcome session of the chief guest, followed by the content delivery by the resource person. Then after the content delivery, this case presentation was done by the participants. And after the case presentation, the overall discussion for that particular day was happened. And finally, the session was concluded with vote of thanks. So the duration was, it started on 24th February, and today and 24th of March, today we are ending it. The average attendance was 41, and total number of registration was around 100, and number of sessions was 30. The attendance percentage was 64, which was the highest percentage. Regarding the comparison of pre and post-test score, the pre-test score was 53% and the post-test score is 77. So we can say that we have completed, we had some effort to complete the objective which we have stated before starting the program. Then the knowledge level, that is pre-test and post-test comparison. If you see the graph, 53, the post-test score, 53 were very knowledgeable, and 36 become extremely knowledgeable. So this 89% gives a good number after the post-test. There is a good improvement in the knowledge. So on behalf of Department of Pediatrics, Bharati Vidyapeeth College of Nursing, Navi Mumbai, I welcome Dr. Professor Vaishali ma'am. She's the Dean, Faculty of Nursing, Bharati Vidyapeeth, to be University, Pune, and Principal, Bharati Vidyapeeth College of Nursing, Navi Mumbai. Without her support, this program was not successful. I immensely thank you, ma'am, for initiating, for motivating, and continuously supporting us to make this program happen. Not this program, in each and every minute things you measure the quality, and you always push us, you always motivate us, you always be a role model to do all the quality initiatives. And without your support, this was also not successful. I welcome you, ma'am, to express a few words to express thanks to ECHO team and the participants and everyone who are involved in the training program.
Thank you, Arunima. Good afternoon, everybody. I take this an opportunity to extend, appreciation to the ECO officials and as well as to my faculties who are involved in this program. Let me first put an acknowledgement to Dr. Sandeep Bhalla, the Vice President, ECO India, for giving us this platform and sharing our thoughts through the resource persons. My thank you note also goes to Ms. Anila Goswami, Deputy General Manager, ECO India, who has been always extending support whenever we are in need. And she is always there for us anytime. I take also this opportunity to exchange thank you note to Ms. Neelam Sharma, Senior Executive Projects Nursing Division, who was there continuously with us throughout the program, since the beginning, that is planning till execution, generating the reports, and also whenever we had some hurdles related to technical aspect, she was also there to support us. I also take this as an opportunity to extend my thank you to the facilitator, Dr. Arunima Srilata, Priyanka Matthew, and Tinu for having put a lot of effort since the beginning, preparation of the module, identifying the resource persons until the implementation part, including the validatory session. Thank you. And also I would like to thank you all the resource persons, including our last resource person, Dr. Janki Patel, because she has shared definitely a very good information on the evidence-based practice. And also a great thank you to all our dear participants without whom this program wouldn't have been successful. So thank you for once and all. Thank you, everyone.
With this note, we'll end this program. Your certificates you'll be receiving via your mail. Neelam, if you thank you for each and every help you have done from the starting till end. If you wish to say something on behalf of ECHO.
Yeah, thank you, ma'am. Am I audible?
Yes.
Yes. Thank you, Arunima, ma'am. And first of all, thank you to Vaishali, ma'am. Okay. Yeah. Thank you to Vaishali, ma'am, and thank you to all the hub team members of Bharati Vidyapeeth College of Nursing, Navi Mumbai. And thank you to all the resource person. And last but not the least, thank you to all the participants for registering for this program and continuous your activeness in this program. So thank you so much. And I'm hoping your contribution in further the programs, not with this Bharati Vidyapeeth and more of the organizations and more of the programs. So please keep in touch with us, as it is means it's beneficial for you as well, for your credit hours and for your learning means perspectives. And next thing is, please, it is just a suggestion from my side. Please keep the sessions interactive, because our resource persons and our experts are putting lots of efforts to organize this program for a 3 months or for 1 month. It is very difficult to them as well to take the time for their busy schedules. So please take advantage of this platform and keep learning, and please come up with the case presentations as well. So regarding your certification, so as we have to analyze your attendance and your assessment scores, so it will take a time of approx 15 days. So after 15 days, you will be getting your certificates on your registered email ID or your registered contact number. So if you have any queries regarding to that, you can always mail us. I will be putting my email ID in the chat box, or you can ask to Arunima ma'am or the Bharati Vidyapeeth members as well regarding the certificate. But we will take a 15 days, because we have to analyze your attendance and the assessment scores. Is there any queries related to anything? Means regarding the certificate? Okay. Yeah, sure. We will be. And so thank you so much. If you have any queries, then you can mail me.
Thank you.
So thank you. All the very best.
Yeah,
Thank you, ma'am.
Neelam, ma'am.
Thank you.
So I'm putting the feedback link as well for today's session. So
Can you just share via chat box also?
Yes,
so
yes,
that,
yes. Yeah. So please fill today's feedback as well.
Participants, please fill the feedback. And we'll share via WhatsApp group also. Thank you, ma'am. Thank you so much.
Thank you so much, ma'am.
Can leave the meeting, ma'am. We have some schedule. All the participants, please complete the feedback and please leave the session. So we'll be sharing the link over the mail, WhatsApp also, group also.